The service has been set up so that service users can book appointments prior to clinics and also on the day of the clinics. We're here every Wednesday from 9:30 till 4. The clinics are set up in a way that service users can see multiple clinicians all on the same day. So all their needs are met within the one attendance, and also follow-ups can be booked for months ahead.
There are really big challenges that face a population that finds it really difficult to access healthcare. I mean, the problem is that they don't often get to access healthcare. So as a result, problems that have been there for years and years get missed or don't get it addressed at the time. I'd split it into kind of mental health needs and physical health needs, and every person that accesses our service here has a story, has had some form of trauma or some form of issue that has occurred to them in their lives. So there's quite often mental health challenges that we have to address and help them with. And with regards to physical health needs, well, it ranges from the simple things like cuts, grazes, things like that, to things that have been addressed partially in the past and not really cleared, things like wounds, or things like, we even have to look at things like cancers, things like that they wouldn't normally have accessed because they just haven't had the means to access healthcare in the past. So it's really the whole gamut of things that one would normally face in a GP surgery, but with a population that hasn't been able to see a doctor or a nurse for such a long time.
So I think the impact so far, firstly and foremost, is the number of people that have been able to be seen by a GP, by nurses, to have bloods taken, to see social prescriber, health practitioners, all of these things that couldn't before. We might have been able to assist a small handful of people to get appointments, but we don't start working at Sanctus until 9 o'clock, so very often it would mean a staff member starting work a couple of hours early to be able to book an appointment for someone, and even then being able to tell them that appointment is booked and communicate with them is really difficult. So the sheer number of people that have been able to access healthcare, and I think the preventative side of it, so a couple of people have had testing that has possibly prevented something life-threatening happening to them. It's very much meant that we haven't had to send people to A&E as a first port of call, which we would have had to do quite often in the past. And our service users know that they can come here on a Wednesday and that they can be seen, and that their chaotic lifestyle that they often lead isn't a barrier to them being able to be seen on the day.
Really bad. I need help because I can't remember things, and I can't. If anyone tell me anything, I forget in a half hour. I seen that doctor here because I've got a kidney problem. He gone right to the kidney hospital.
Mental health, to be honest, because I've been on a course for mental health for about a good 6 years, and they keep on coming and then going, and then I come here and I get the help.
this project means everything to me. I've always had an interest in health inequalities. You know, I work for the NHS. I want to help people.